A crooked smile, uneven reach, abnormal speech.
Good morning, I'm Dr. Ellsworth, and I'm going to be your neurophysiology professor. We're going to start off today by learning about transient ischemic attacks, or commonly known as a TAA, which we can sometimes refer to these as a mini stroke. The transient ischemic attack is a neurological event with the signs and symptoms of a stroke, but it will resolve itself in a shorter period of time. The TAA most likely is an indicator of a possible full-blown stroke occurring in the near future. Therefore, a TAA should be labeled as a warning stroke. Cerebellar ischemia is an insufficient blood flow to the brain. When cerebellar ischemia occurs, nutrients, including oxygen and glucose, are reduced. Glucose is the brain's main source of energy. In the adult human brain, neurons have the highest demand of energy, requiring continuous glucose delivery from the blood. Glucose metabolism provides the fuel for physiological brain functions through the formation of ATP. ATP is what gives the energy for organization of neuronal and non-neuronal cellular maintenance in the brain. ATP is needed for the generation of neurotransmitters, which are vital. Therefore, tight regulation of glucose metabolism is critical for brain physiology. Disturbed glucose metabolism in the cerebrum can indicate several diseases affecting both the brain itself as well as the entire body. In addition, toxic metabolites cannot be removed efficiently due to restricted blood flow. These metabolites can include things like lactic acid. TAAs can signal problems leading to disability, further strokes, and even death. TAAs are caused by thrombosis in the cerebrum when blood flow to a part of the brain is compromised. A thrombosis is a mass of coagulated blood blocking the blood vessels. TAAs are caused by one of three things: low blood flow in a narrow part of a major artery carrying blood to the brain, usually the internal carotid artery, a blood clot in another part of the body dislodging or breaking off and then traveling to the brain, blocking blood vessels in the brain, or narrowing of a smaller blood vessel in the brain, blocking blood flow for a small period of time. This usually is caused by a buildup of fat, cholesterol, and other substances in the arteries due to a faulty diet and lack of physical activity. Syncope can develop due to generalized cerebral ischemia. Prolonged ischemia can result in a brain infarction. When symptoms of ischemia last for short periods of time, typically 5 to 30 minutes, and are focal, then the term transient ischemic attack is applied. About 1 in 3 people who have a transient ischemic attack will eventually have a stroke within the first year after the initial occurrence. A transient ischemic attack can confer a high risk of stroke immediately post-event, with an average of an 11% risk during the first 7 days. The risk of the stroke is the highest within the first 48 hours following a TIA. TIA is a sign of impending stroke if the person is 60 years or older, has diabetes, or it lasts more than 10 minutes, causes difficulty with speech, or if there is weakness in the body. Since TIAs resolve on their own, the main goal is to minimize the risk for the future TIAs and strokes.
Hey kiddos, I'm Dr. Dan.
Hey, Dr. Dan.
Strange and complicated word for kids to understand. Most kids usually think of the word stroke as something you're petting. For example, Matt stroked the fur of their greyhounds. In this case, Matt was petting the dog or feeling the fur. But if a person is having a stroke or had a stroke, the meaning changes. Strokes usually happen to older people, like grandparents, but they can also happen to kids in very rare cases, and younger adults as well. A stroke is when blood flow to the brain is stopped. Blood flow happens through the veins and arteries, which are very small tube-like structures in the body. This is important because the blood brings oxygen to all tissues of the body. Without oxygen, the tissues would die. Are there any questions? Jesse?
Yeah, what exactly is an artery?
Weren't you paying attention, Jesse? It's a blood-carrying tube.
Thank you, Dr. Dan.
If something is blocking the tubes where blood is flowing, a stroke can happen. There are different types of strokes, but we're going to talk about a certain kind of stroke called a transient ischemic attack, or TIA. A TIA is a mini stroke. A mini stroke is when blood flow is blocked to a certain area for a short amount of time. These types of strokes do not usually cause lasting damage, but they can help tell you if something is wrong. If a grandparent has a mini stroke, they should contact a medical professional immediately. The good thing is most people recover from a stroke, especially if they know the warning signs, and they can get help very quickly. There are things to look for if you think one of your grandparents are having a stroke, and we'll talk about these next. TIAs are caused from blood clots. Blood clots are a blockage in those straw or tube-like things called arteries and veins. The artery carries oxygen in the blood, and if there's a blockage in this, oxygen can't get to the muscles, organs, or the brain. A TIA specifically is a blood clot to the brain. Oxygen can't get to parts of the brain for a short period of time, causing symptoms and signs to occur. For example, if a blood clot happens, the person may not feel their face or might talk funny. The symptoms last until there is not blockage in the artery anymore. Now it can be scary if someone you know has a stroke. Strokes can be big or small. If the stroke is small, usually the person can get better soon and will go back to normal. It can take a little bit for that person to feel better though. If this is the case, just remember to keep encouraging them to try their best and tell them you care about them. Being around friends and family can help the healing.
If your patient experiences any of these signs and symptoms, they may be having a TIA. Some of the symptoms are angina pectoris, severe myocardial ischemia, shortness of breath, anxiety, a cough, fainting, syncope, palpitations, sweating, confusion, and profound weakness. Once your patient has had a TIA, there's a few different treatments that we can carry out. Medication is most often used to treat a stroke or a TIA. Two main types of medications are used. They're going to be antiplatelet and anticoagulant medications, or more commonly known as blood thinners. Some of these blood thinners include aspirin, Plavix, Tislid, Agranox, and warfarin. There are also some medications for high blood pressure that can help reduce the risk of a TIA, and these are going to be your angiotensin II receptor blocker, ACE inhibitors, beta blockers, and diuretics, just to name a few. If a patient has already experienced a stroke and we've tried medications, there are also a few common surgical procedures that we can use on them. A carotid endarterectomy, which is going to be involving removing the plaque from the internal carotid artery, or a carotid angioplasty and stenting. This involves using a balloon-type device to open a clogged artery and placing a small metal stent around the artery to help keep the artery open.
Now we will look at common symptoms of a stroke. Many symptoms include numbness and weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes. A lot of times there is trouble walking, dizziness, loss of balance or coordination, and severe headache with no known cause. Pain, however, is the most common complaint. A lot of patients complain of squeezing or heavy pressure, a tight band around the chest, something heavy sitting on your chest, or bad indigestion.
The CNS and PNS both have structures involved with a TIA. In the CNS, we're going to temporarily block certain functional brain areas from receiving blood supply, which will leave the brain drained of oxygen and its nutrients. This can cause a temporary interruption in certain areas of the brain, vision, motor, and speech. In the PNS, certain nerves will show diminished function temporarily during TIA, but there's no long-term effects from it. Now, during a TIA, there can also be ipsilateral retinal blood loss, which will lead to transient monocular blindness. This occurs 25 to 35% of the time. There will also be lateral tongue biting, muscle pain, sweating, pallor, needing to defecate and urinate.
Now there are 3 steps that you can take to avoid having a stroke. First is to avoid smoking. As many of you have learned in class, smoking is not good. Quitting smoking or avoiding secondhand tobacco isn't easy, but it is one of the best things that you can do for your health. Second is you should be physically active. Decide how to fit more activity into your daily life. Choose activities you enjoy, set realistic goals, and give yourself rewards for exercise. Lastly, you should be very conscious of the things you eat. It is very important to eat 3 healthy meals a day. Plan your meals with high fiber, fruits and vegetables, and whole grains. You should reduce the amount of fat you intake and plan to cut down on your calories. Michelle?
What's dizzy walking?
Here, I'll show you.
Did you know there is an acronym developed in the United Kingdom for ambulance staff to quickly assess strokes? The acronym is FAST. F stands for face, if one side of the face is drooping. A means arms, if the person cannot hold out both arms. S means slurred speech, slurring words or poor understandings of simple sentences. And T means time. If any one of the FAS signs are positive, it's time to call 911 as soon as possible.
A crooked smile uneven reach, abnormal speech,
Common symptoms of having a stroke.
a crooked smile, uneven reach, abnormal speech.
If someone has a stroke, here are the signs. Don't waste time, a quick response could save a life. If someone has a stroke, here are the signs. Don't waste time, a quick response could save a life. If someone has a stroke, dial 911, let the paramedics come. Let them be the ones who drive, they will save precious time. Dial 911, let the paramedics come. Let them be the ones who drive, they will save precious time. If someone has a stroke, here are the signs. Don't waste time, a quick response could save a life.